Hi everyone, this is Mr. Neil Writer, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed WAXscope, which we're hoping to launch in early December 2022. And if you are interested in the WAXscope, feel free to email info@clearwax.co.uk and we can add you to our mailing list. So we have a patient here who attended with bilateral, fully occluding, large lumps of earwax, large plugs, and if you watch till the end of the video you'll see a still image and you'll just see how large these plugs are. So I'm just commencing in the patient's left ear and we're using our standard size 4.25mm speculi to dilate and straighten the ear canal. We've got a smaller size, a 3.5mm, and two larger sizes, a 5mm and a 5.75. Now this wax plug is quite stubborn, and in a moment I'm going to use olive oil spray. So the olive oil spray that I use, it's the Clear olive oil ear spray. So I was recently approached and invited to become a healthcare advisor for Clear, which is an ear care over-the-counter product range brand, and they sell some really great products, including their flagship product, which is the olive oil spray. That is available to purchase from our website. So if you're a member of the public and you want to use some olive oil spray into your ears to either soften earwax or to help lubricate and hydrate the skin to prevent from drying and cracking, please visit our website, www.clearwax.co.uk, and visit our shop. And if you're a clinical ear care specialist and want access to our trade shop where you can buy the Clear olive oil ear spray in trade bulk, which then you receive trade prices, visit our website, select sign in, and then register as a professional, and you'll have access to our trade shop. So I've just removed the first plug from the patient's left ear, and you can see you've got a second plug here, which is a bit deeper. And I'm just going to get this wax plug in focus, as you can see. This is right up against the patient's eardrum, this last plug. You can see we've got a great view here. And I'm just going to slowly bring this out. Now, I've previously performed earwax removal using a microscope and also head loops, where we use speculum to help straighten and dilate the ear canal. I'll just come back to that in a moment. Now, this is the patient's left ear. You can see the eardrum there. You can see all the blood vessels. It's got a prominent anterior recess, so you can't see into that region. And I think sometimes it can be taken for granted putting a speculum in the ear. Now, if you could just examine the ear to perform otoscopy, that's fine. But there is an art to straighten the ear canal when you're performing microsuction with a speculum. And it's just getting the right angles, ensuring you're selecting the right speculum size, the correct depth, knowing the ear anatomy. So some parts of the ear are uncomfortable, so you can't over-insert. Now, our speculum that we're using, they have a flared proximal end, so you can't over-insert. They're like your typical Shale or Rosen or Gruber speculum, designed specifically for wax removal, so you can't over-insert these speculum. They get trapped at the entrance because they've got a flared proximal end. And depth is just so it just stretches up to the second bend, where just before it terminates at the bony part of the ear canal. So in the right ear, I've just put some drops in. I just had that feeling that suction's not going to do the trick here, even with all the drops in the world. So I'm just using a Jobson horn here. You can see I've inserted it to the roof. I'm going to bring this forward and out of the ear. So this plug separated in two. So that's the first plug. There's a bit of skin there, and this is the tailing end of that plug. It just got trapped near the entrance. So I'm just going to go over and in behind with the Jobson horn and bring this forwards and out of the ear. And that was a very large plug there. So I'm just going to re-enter the ear. Just going to go in and I'm going to straighten the ear canal with using the speculum. And you can see the eardrum there. Just going to get it in focus. Again, quite a prominent anterior recess here. You can see the anterior canal wall. It's quite prominent, but we can see the whole eardrum nonetheless. And they're the wax plugs. So I've got a pencil there to give you some perspective. You can just see how large they were. Well, I hope you enjoyed that video. And if you are interested in the WAXscope, please do email info@clearwax.co.uk and we shall add you to our mailing list. Thank you. Bye.